Make sure your face is looking. Come on, face looking.
Oh, hello.
Face looking.
Hi.
And there's Wilbur.
You hear the song, Will?
Okay. Do you know what cerebral palsy is? The Mayo Clinic describes cerebral palsy as a general term for a group of disorders that affects a child's mobility or coordination. But to better understand cerebral palsy, we need to look at the different causes, effects, and treatment options to better understand this disorder. The CDC estimates that 1 in 278 children have cerebral palsy. So to better understand these children that live in our society, we need to understand how their life is affected by this disorder. I speak on behalf of a mother on myself who has a son with cerebral palsy. I've seen some of the struggles that he has faced and some of the struggles his friends face who also suffer with cerebral palsy. To understand their struggles, first we'll look at some of the problems that cause cerebral palsy. Then some of how cerebral palsy affects the brain and the body. Third, we'll talk about some of the effects that cerebral palsy can cause to the body. And lastly, we'll look at some of the treatment options. First, there's a variety of problems that can cause cerebral palsy. The first of which can be complications from birth. It can be low birth weight, a multiple birth pregnancy, or premature birth. The mother can also experience complications like a breech delivery, or she can have a pre-existing condition which can cause complications. A child can also have childhood illnesses like meningitis, which is swelling of the spinal cord or brain, or viral encephalitis, which is swelling of the brain itself. Children also during the early years can suffer a stroke or an injury that can cause brain damage. And on rare occasions, children can experience severe cases of jaundice, which will also cause cerebral palsy. There's no one defined cause for cerebral palsy, but with extensive research, we have leveled it to a few areas. Second, to understand how to cope with cerebral palsy, we need to know what happens exactly with the brain and body connection. The brain suffers a degree of damage to a certain area where that controls the coordination and motor function. Once the brain is damaged, the brain can no longer communicate with the body to work its muscles. Once that connection is lost, muscles become underdeveloped or deteriorate, leaving the person or child unable to use them. The child can suffer several disabling effects, such as feeding problems, mobility issues, and uncontrolled muscle movements. Third, once a child is diagnosed with cerebral palsy, it is important to know how it could affect their daily life. Most importantly, these children are affected with mobility issues because their muscles aren't strong enough and their bones can't support their body weight. They can suffer involuntary movements, muscle spasms, and nerve damage. Children also, because this is a form of brain damage, will suffer mental and intellectual deficits, which will be determined depending on the degree of brain damage. They also can suffer several other medical disabilities. Gershon Willoughby, who is a researcher, estimates that there are 35 to 50% of children with cerebral palsy have some epilepsy or some form of seizure disorder. To live with these children and to understand them, we must recognize the effects of cerebral palsy so we can effectively treat them. Lastly, since there's no cure for cerebral palsy, the treatment options are left to symptom management. Since the primary symptom is muscle problems, we treat the muscular issues. For children who have rigid muscles, you can either give prescription medication like muscle relaxers, or there's also surgical procedures where they cut the tendon to release the muscles. For children who have low tone muscles, who cannot use their muscles, they can either use orthopedic braces, or they can insert rods and bars to stabilize the bones and muscles. The primary source of treatment for these children is therapy. They can do physical therapy, which will work the large muscle groups, occupational therapy to work the small muscle groups, and speech therapy to address feeding and language issues. These therapies include a therapist who who will manually work the muscles for the child to stretch the muscles and tendons and hopefully get some muscle strength back. Most treatment produce slow progress, but they can improve a child's ability to cope with the effects of cerebral palsy. The aspects of cerebral palsy can be different for every child, but to gain a better understanding, we have examined some of the attributes of the disorder. First, some of the possible origins. Second, what occurs in the brain. Third, some of the negative effects the child may experience. And lastly, the treatment options that will depend on the child's symptoms. So next time you see a child with cerebral palsy in your community, remember, with their daily challenges, they already live a successful life. So what exactly is cerebral palsy? It's a child's ability to overcome their challenges daily. Okay, put your picture on the thing. Pictures, and there's the problem.